I really feel like that's a nutrient that doesn't get spoken about as much.
Well, a
There's a
lot of
lot
people
of
are afraid of vitamin A through pregnancy because mostly we just hear that it causes birth defects, right? We don't hear that it's actually an important piece of all this.
Well, it's essential. I mean, when you research vitamin A, there's some of the compelling research that I saw. I mean, I know we're not animals, but sometimes we have to gather some information through animal studies. So,
Mhm.
a couple interesting fun facts about vitamin A. Like, there's research studies where they're looking at suppressing a man's ability to process vitamin A as birth control
Hmm.
because it's so essential for fertility and sperm production and testosterone production that if you have an animal study and you give them a diet that is entirely devoid of vitamin A, and we're talking about retinol, not beta
Yeah.
carotene, if these animals are given a diet without any vitamin A, the male rats in the study stop making testosterone and stop making sperm. Like it was
Hmm.
like the on-off button.
That's crazy.
And then the female rats, there's stages. So depending on how much the deficiency is, if they're able to conceive and like carry, the babies could be born blind, stuff like that. If
Mhm.
they are, but then if they're even more deficient, they won't even conceive, or they will conceive, and they call it fetal reabsorption in these animals, which is essentially like an early miscarriage. So
Right.
it's really interesting when you look into vitamin A. There's an interesting study that I'm sure we cited in Real Food for Fertility, and I cited in the Fifth Vital Sign, where they look at the role vitamin A plays in lung development. So when you're deficient, I mean, it could really have a negative effect. It plays a role in the development of the fetal heart and the lungs and our ability to see and hear.
Hmm.
So by scaring women away from vitamin A entirely without providing any context,
Yeah.
then they really do a disservice. When we look at kind of those real world studies where you just have a population who consumes liver as part of their diet, so there's a few studies that we've looked at that have just that kind of scenario, then we see that in those populations where they just consume liver as part of their diet, you don't have this issue of birth defects. There's other studies that look at the difference between the synthetic vitamin A and the vitamin A that we consume in liver that show that the synthetic vitamin A, when you consume it, you produce a significantly higher amount of the teratogenic metabolites that are linked to birth defects. So
Right.
it's important not to like go hard, but there's a lot of there was this one study that I looked at outside of pregnancy. So this is a study that is just about vitamin A toxicity as a concept, not about the teratogenic aspect. And so it was this woman, it was a case study, and it showed that she had vitamin A toxicity. But if I'm remembering correctly, she had consumed something crazy like 400,000 IUs of vitamin A a day for like 8 years. Like it
Oh,
was like a really ridiculous. You're just like,
that's
what,
a lot.
lady? Like, what? Who told you to do that? Like, you're just like drinking the bottle. Like, that's a lot
Right. I
of
was
vitamin
gonna
A,
say,
right?
how is she even getting that
I
much?
know, like that's a lot, right? It's crazy. But then if you were to try to like do that with liver, you'd
Yeah.
have to you'd have to eat like 8 pounds a day. Like it's just completely like illogical. Or you'd have to find a polar bear anecdotally because
Right.
they are all carnivores, so their livers have like a million IUs, so
Right.
they're yeah. So don't eat polar bear liver, like you know what I mean. Don't eat polar bear liver. Don't take 400 IUs of vitamin A a day.
There
I
is a
mean,
limit.
yeah. I mean,
Yeah.
the book we give some really, and if you're not pregnant, you can eat a lot of it. And the point of sharing an example like that is like you're not gonna like outside of this teratogenic issue. If you are not even pregnant yet, this is your opportunity to get as much of these nutrients on board as possible.